Researchers are now questioning just how effective the Moderna and Pfizer vaccines can be for those who have received solid organ transplants. Our Angeline McCall breaks down what they're currently looking into. Angeline.
Ryan, findings were published earlier this week from researchers at the Mayo Clinic after 7 organ transplant recipients who were all vaccinated either with 1 or 2 doses contracted COVID-19, leaving 5 of those patients in the hospital. But here's what gave the hint to researchers that the vaccine may not be effective for solid organ transplant recipients. Only 1 of those of the 7 originally who had tested positive had the antibodies they should have gotten from that vaccine. New research suggesting the COVID vaccine could have limited protection for those who have received organs.
It's not a huge surprise to us that there are some patients that may not have as good of an immune response to vaccination. And I don't think it's just standalone and unique to the mRNA, but it can be with other vaccines as well.
Dr. Andrew Jameson with Mercy Health St. Mary says doctors commonly explain risks for those with organ transplants. And this is another for a group that typically takes steps towards their own health.
And really, that's the same kind of conversation we need to have with COVID-19, that even if you've been vaccinated, your protection might not be perfect and might not be the same as what other people's immune systems have responded to.
Dr. Jameson says despite the questions over the efficacy rate, he is still encouraging organ recipients to get the vaccine.
But the good news is these vaccines give us an immune response that is so far above the level needed to prevent COVID-19 that even a half or a quarter response will be a huge step forward towards immunity and really protecting them. And one thing that we found with a lot of these vaccines, or with the COVID-19 vaccines, is that a little bit of immunity goes a long way to prevent hospitalizations, to prevent.
Johns Hopkins has also been researching the lower efficacy rate for organ recipients, saying that roughly 17% of those patients have developed detectable antibodies against the virus. In the newsroom, Angeline McCall, Fox 17 News.